Yes, very much, very much. Okay, and I hope the slides are visible. So thank you so much for giving us this opportunity. And it's a privilege to address, friends across the border in Nepal. And also, I understand quite a few people from India are also joining, and maybe from other places. So to all of them, namaste, namaste, which is a form of greeting in India and of course Nepal in Hindi. So that's we say namaste. Kapil, a minor correction. I'm a professor now. I was a professor and head for 5 years, but now I'm a professor, but that's okay. So let me start. I want to know, this is greetings to everybody from any part of the world. So let's, move on. So I would like to, know from participants, and I don't know, like Kapil, if it's possible for them to respond, or maybe in the chat they can put up, and you can tell me. So the first statement I put up to you for your agreement or disagreement is communication is a natural instinct. What do the participants feel? Do you think that communication is a natural instinct? You can put up in the chat. I think, is that possible for them, Kapil?
Yeah, yes, sir.
Okay. So you can let me know what do they think. Majority, what do they think? And I'll move on.
Okay, sir. Everybody's saying yes.
Yes. Okay. The
Yes.
art of communication cannot be learned. This is the second statement I'm making before I start my presentation. So the art of communication cannot be learned. Again, you need to give me your opinion, agree or disagree.
It's a no, sir.
What is that, Kapil?
Yes, most of the people are disagree and saying the no.
Okay, so they disagree. That means it can be learned. Okay, that's good. That's good. Okay. Communication is the foundation of trust. What do people say? I say communication is the foundation of trust.
Yes, sir. It is yes from most of them.
Okay, good. Miscommunication is an annoyance, but seldom has serious outcome or consequence. So it's an annoyance, but it does not lead to any serious outcome. What do you feel? Do you agree or do you disagree?
Okay, it's a disagreement, sir.
Okay, so that means they think not just annoyance, it also has a serious outcome. All right. So we heard that, people agreed that it's a natural instinct. So if that is a natural instinct, can it be learned? And that's the dichotomy, if you see, or there is a kind of contradiction. And people said that yes, it can be learned. That's, cannot be learned is not true. They disagreed. And they agreed that it's a foundation of trust. And we'll go forward and see, how it helps us in the profession that we are, health profession. And I understand most of you are from optometry and from other backgrounds as well, and some are from different healthcare professions and maybe else of the other professions also. Right. I put up another thing. Many people believe they do a good job of listening. What do you think? Do you think that it's true? Let me reiterate and repeat the statement. Many people believe that they do a good job of listening. So it's a statement I'm making, and I want to know what you think. So
Yes, yes.
what's the general? Yes. Okay. So is that true? So in reality, I say they are only hearing and not listening. Do you agree again? And if so, is there a difference between hearing and listening, or are they the same? What do the people feel? Any responses, Kapil? Kapil,
No,
are you
sir.
there? Am I audible?
Yes,
No?
sir. Okay, there is a difference.
Okay.
Yes, there is a difference. Yes.
Okay. So the difference is that in listening, you are actually processing what you heard. So you can just hear me out today, or you can actually think about what I'm saying. You understand, and maybe you can, you know, apply or derive meaning from, and then maybe go with that. So in hearing, you will just hear. You will not do anything more than that. So you're not going to imbibe it. You're not going to process it. You're not going to apply. You're not going to, you know, think about it. And that's the difference, and which is very, very critical, especially in the profession that we are in. For anybody, but definitely for the profession that we are in. Okay, so with that, let me start, very simple things about communication, the basics of communication skill. And as I said, greetings to you all wherever you are joining from. Now let me go back to this. Why is it important to listen? Why should we listen after all? Why is it important? So it's important because usually we generally, as people, as person, we like talking more than listening. We like to talk because that gives us a kind of sense of superiority. Sometimes we also feel that yes, we have conveyed what we wanted to, and we feel that yes, we have already, come out with all our thoughts and everything. But many a times we don't realize that if we do not listen, we are not really complete process of communication. And if we can put up the right question, we can get somebody to tell the whole, history or whatever about themselves. So that's very, very important. So if you ask the right question, and please mark, the key is we should ask the right question in the right way, and we can get people to tell about themselves. So listening also helps us in, complimenting someone. Why? Because the moment I'm listening and I'm understanding, I'm processing, I'm showing to the other person who's speaking to me that I care. I care for you. You're valued. So that's again very important. And I'm sure that you will understand that this is very important in the profession that we are in. Listening also helps to build trust. And building trust is the foundation of a good relationship. So if we need to have a good relationship with anyone, not just our patients, clients, or anybody, neighbors, friends, we need to listen, because that will help us to build the trust. And trust is very important in any relationship. So few things about listening. Now it's like receiving messages, and we have 2 ears. That's why they said that we have 2 ears and only one mouth, so that we can listen more and talk less. So listening requires concentration and energy. So we need to concentrate on what is being said. It always helps us to make a mental connection with the person who's speaking. So it involves a mental connection. It also sometimes includes a willingness to try and see things from another person's perspective, putting yourself in that position and seeing how that person might be seen. And it also requires that we suspend our judgment and evaluation, because many a times we say, oh, this, that is like this only. So we need to suspend our judgment and listen. First, we need to listen, process the information, and then come to conclusion. Now, just giving you some facts and figures, it has been found out that majority of lawsuits against healthcare providers results from miscommunication. I'm not saying there are no other things involved. Please don't get me wrong. What I'm only saying is miscommunication forms a big chunk of it, because of which lawsuits are happening. And this data is obviously more from the West. But even in countries like ours and Southeast Asia, this is again true. 85% of the people are nervous and anxious when they have to face an audience. Now, what do I mean by an audience? Do you mean that on a stage? Do you mean that I'm performing something? Do you mean that I'm going to give a speech? Not necessarily. It can be any audience. It can be an audience just of 2 or 3 people. It can be 10 people. It could be 200 people, or any number. So many people feel nervous and anxious when they have to face an audience. And the reason being that this is always a level of whether I'm going and in the right direction. Am I talking correctly? Am I able to convey? And that nervousness and anxiety is there. So what we need to learn is we need to learn to manage. And I've shown you different scenarios. So we need to learn to manage our nervousness and anxiety. Please mark my words. I'm carefully choosing the words. I'm not saying that we need to overcome. Sometimes it may not be possible, but we can manage. And manage means we can have it in such a way that we still have it, but it doesn't hamper us. It helps us to continue with our routine things, or we can do what we intend to do. At the same time, we make that nervousness and anxiety so little that it doesn't come in the way. Of course, it comes with gradual practice by conscious efforts and things like that, and of course, encouragement from people around us. So communication is the key. Now, let me tell you, why is communication important, especially in healthcare? Because it helps us to build a relationship. And that means if I have this good relationship, that will lead to better overall health and outcome, improved patient satisfaction, improved compliance. For example, you prescribe somebody glasses, contact lenses, and you ask them to wear it in a proper way. Now, how are they going to follow it if you do not have this good communication and not had a good bond or relationship with them? So if they value what you say and the relationship that you have established, automatically they will have a better compliance. At the same time, it reduces the risk of medical malpractice, and it improves personal and professional satisfaction of the healthcare professional also. So what is communication? Please remember, it's a two-way process. It cannot be ever one way. It has to be two-way. It helps us to reach a mutuality of understanding, and we exchange information. We create and share meaning. So it's the exchange of thoughts, ideas, feelings, information, opinions, knowledge, anything, or mix of these. And please remember, the key is mutuality of understanding. So that means both the parties need to be in the understanding, and they should have common kind of understanding. Many a times what happens is, though this says about doctor, but it can be anybody. So we have this, who knows better? Have I done this studies more, or am I the healthcare provider, or you are the healthcare provider? Who knows better? And that's where the clash happens. So the patient needs may be different, whereas we think that we know everything. So that also happens. And that's another reason why we need to listen. Many times they may have different concerns. So that's very important for us to understand. Many a times there is lack of clarity, assumptions, things like that. And that's why they have come up with a lot of these guides and other things in the US and other places, where patients guide to communication in the exam room and beyond, and how much you should talk with doctor and things like that. So how do we communicate? We communicate in different ways. The most important being listening. We need to listen. हमको सुनना है. अगर नहीं सुनेंगे तो हमें पता कैसे लगेगा कि कोई क्या बोलना चाहता है, उनकी क्या दिक्कतें हैं, उनकी क्या समस्या है. So this is very important for us. Listening. Speaking. Of course, once we listen, we also need to speak. Some of you may not have realized, but reading is another way where we communicate, and of course writing. The writing, because many a times we will write and this goes to other person, and then he or she has to read and decipher, understand from that. Many a times your notes, your instructions, all this comes under that. And nowadays even things like emails and letters, of course, in the olden days. So all these are part of that. Now oral skills are different. Presentation skills, audience awareness, critical listening, body language, all that comes under that. But in written, you can have things like academic writing, which involves revising, editing, critical reading, presentation of data. At the same time, please don't forget, a very important component is non-verbal. That means we have to be aware of the audience. What is the audience? What is their expectation? What is their level? Then how do I present myself? Now, if you see, today I'm dressed, I'm formally dressed, and then I'm presenting to you. I have not come unkempt. My hair is groomed. It's not that I'm unshaven. So it's also important because that gives an impression about me. Now, for example, if I have to go for an interview, I cannot just go unkempt with my, grooming not proper and things like that, because that carries an impression that talks volumes about me. It's a personal presentation. Same time, body language, and I'll come to that a little later. And that link, what Kapil has shared in the chat box, was about body language. Now, coming to oral communication. Now, this, as you know, is the spoken language or spoken, sentences. So this is a form of speech, and then we use it in different languages. Please remember, it can be in different situations. It can be face-to-face communication, and nowadays with COVID being there, a lot of these webinars are happening where we are actually virtually connected, and that's again very important. Telephonic communication is another one which is very important. Public address, many a times you might have to deliver a speech. Many a times you might have to go to media like radio or TV, and you might have to answer or address the audience. So, or live phone in programs. It can also be interchange of views in a conference or a meeting. It could be lectures. So all these are verbal communication. Now, can I request somebody to read this for me? What is on your screen? Can
Okay.
someone
I
read
don't
it?
say I
Yes.
don't I didn't say you
I
are stupid.
Yes,
I
I didn't
didn't
say
say
you
you
were
were
stupid.
stupid.
Okay. So can I request you to read this again, the next sentence?
I didn't say you were stupid.
Could you please repeat? It was not audible
I
enough.
didn't I didn't say you were stupid.
Okay, so what's the difference between the first and second one? So what's the difference? Is there a difference?
Yeah, handwriting.
Pardon
Presentation
me?
is different. Presentation is
Presentation is different.
different.
Okay, so is the meaning different? Did you get my question? I'm trying to ask you, both the sentences, except for the way it's written or maybe the the font, is there a difference in the meaning? Yes, anyone? Kapil, do we have any people answering this? The lady who answered, can yes? So let me read it out for
Is
you
there
again.
anyone who want to answer this?
Okay, Kapil, do you want to try? Am I audible? Am I audible?
Yes, sir, yes. So
Okay.
Solugotham said that second when was louder than the first, and Basanta sir saying that way of expression is different.
Okay, so let me say this for you. The first one I just read out, I didn't say you were stupid. The next one, I didn't say you were stupid. Now, do you think there is a difference?
Yes, sir.
What is the difference? The sentences are
In
same.
on yes, on pronunciation there is a difference on the say.
Yes. Is the meaning different?
Yes, sir.
Yes, sir,
Yes.
it's
Tell me
different.
what.
Yes.
You're right. So, what is the difference in the meaning? Second one, what do you understand when I say that? Any idea? Okay, let me try to do this. I didn't say you were stupid. Okay. Now, if you look at this, all the three sentences what I put up are same, except for I put say there in bold, you in bold. Okay. And I'm reading it out again for you. The second one is I didn't say you were stupid. I didn't say you were stupid. What's the difference between the two? The third and the second. Is there a difference? Yes, Kapil? Now?
Yes, sir. I guess it's a different. Yes.
Yes. So what is the difference you could perceive when I said that? So let me give you an idea. See, the sentences are same as you read, but I didn't say you were stupid. So I didn't say it. I might have meant it. Okay. So I may not say it, but I'm meaning it that you are stupid. Whereas I didn't say you were stupid, not you, man. Anybody else, he, she, they, anybody can be stupid, but not you. I didn't say you were stupid, right? The emphasis on you. And then the last one, I didn't say you were stupid. So I'm emphasizing that word stupid. So you can be anybody else. You can be, dumb, you can be jackass, whatever you call it. Okay. But you are not stupid. So I didn't say you were stupid. You see that emphasis on the word. When I'm using the same sentence, I'm actually trying to emphasize differently. Okay. So again, the way we say something rather than what we say changes the meaning. And that's important for us to understand. So when we sometimes mean something, it's because how we say it. And this is what I'm trying to give you an idea. And this is also known as paralanguage, which also includes things like sighs. Sigh means, look at, and gasp, which I did, like I'm just breathing out. Or sometimes people have ooh, ah, like those kind of things. And that again, makes a different kind of meaning. Now let's come to written communication, and I'll give you some examples here as well, and why it's important for us. So by means of written symbols, we write this printed or handwritten, and many a times in our profession, we will have orders written, instructions written. But please remember things like letters, references to be seen by somebody, memos, reports, even policy manuals, information bulletin, publications on the right side if you've seen. And then we also communicate by written text using SMS, WhatsApp, and email. So those are the things also. It's important for us to understand that nowadays when we are using these SMS, WhatsApp, and email, and many times not just personal communication or informal communication, but also for formal communication, it's important that we have a few things in mind. And I will show you some examples. Another thing, many times when we want to go for higher studies or higher things, or if you want to get into some kind of a course or any kind of a workshop, or sometimes when we have to write an application, a letter, it could be a letter for even job, can be anything. It could be asking somebody for a letter of recommendation and how that letter is written, and reference for opinion or consultation, email, WhatsApp, SMS. Let me show you some examples again. Now, if you look at this, these are two things which on the left is a handwritten kind of a consent, and I'm not sure if you can read it, but I'll just read it out for you. So I have been explained in my own language about the condition of the patient and the need for dialysis, catheterization, and dialysis. I've been explained about the complications associated with dialysis and dialysis catheterization, such as bleeding, hematoma, infections, and injury to secondary structures. In spite of all these, I'm giving consent for dialysis and dialysis catheterization. Neither the doctor nor any other hospital staff shall be held responsible for any untoward outcome, including death. Now you ask the patient to sign. Do you think this is going to be working out? And that's just written. And then, so this also sometimes needs further explanation and should be in a better way. Similarly, right side you see a letter which says that they want a particular thing, and you need to have deputation of specialist gynecologists. So again, that's what I've shown you here. Again, one more thing is that format. And see, we may not have a very beautiful handwriting, it's okay, but the way we format it also gives an impression about us. So it's important that when we communicate, it should be in a proper way, written in a nice way. And so it's important for us. And this again, it's a very vague letter, so it will not really help. Now again, sometimes when we come back after attending some things and we want support, so there has to be a formality in that, and then the way it is written, it should be addressed properly. Now this, trust me, I have not edited it. This was a curriculum vitae we got for a particular post that we wanted in the institution, and this is how it is. Now, if you see this kind of a CV, do you think that you will have a lot of confidence in this candidate? Obviously not. So you need to have a CV in a proper format. This is the only thing which was there in the CV, and which is, again, digging your own grave, I would say. Similarly, personal statement. When you're asked to write, please remember that the idea of the organization or the institution is that they are trying to judge you on your writing, as well as also trying to know about your personality. So give them that impression, give them why you want to. So here, if you see, there are things like this: nascence, that's mistaken, the spelling is not correct. Again, that goes against the candidate, and in competitive world this can make a lot of difference. Then methodized, organized, the way it's written. And also look at this: I am sure. Now this is more of an SMS lingo. We should avoid it as far as possible when there is a formal communication. So it's very important for us to understand these things. Similarly, personal statements. Now, somebody has applied for a vice president post. I'm pulling off this post. I'm like bring out the best out of myself in pulling off this post. I, as a vice president, you read throughout the letter I. Now this is a vice president post and it will require teamwork. So that also has to come in. Then in the end, considering all the above statements, I feel that I can handle the post of vice president. Now what does that mean? I can handle, so you need to be a little more careful when you write. And this was a letter which was addressed to me when I was heading the department by one of the students, and wants to go home. That's okay. Wants to give the test later. But if you look at this, for this act of kindness, it should be skidness. Are you kidding me? I mean, do you think that, this kind of letter? So I think this is very important. This kind of gives me an impression that you're not serious. So it's very important for us. And then again, instead of, being polite and humble and courteous and requesting, it's like informing, I am going for my brother's marriage and so day. So I won't be able to attend. Okay. This is like I'm trying to tell my subordinate, or maybe, my at least a peer. And that's again not a very good idea. So you need to understand. Similarly here, if you see, very poor language. And look at this, it looks funny. Coming from a school, especially when I was the president of the Rotary Club. So, and then it says that thank you for building up whatever, like, facilities and all. And now all the students freely to go to take meals without getting wet during rainy season. And on the other hand, the boys go for their personal needs. It becomes a little funny kind of a meaning. So, it can be distorted. Please understand. Now, coming to, one of these requests that came to me. Now, it's good is that if you look at that, the person has given the name, the college ID number, which becomes easy for you to track and find the records. So it's good. But if you look at, a lot of other things could be done. So greetings could be there, formal mail, details about the self, the time when the person was a student, also about what was the achievement, etc. a little bit. Then again, if you're asking for a particular recommendation letter, any particular emphasis is needed, any format or specific instructions from the university. What is the deadline? And then again, many times people are busy, so you might have to, like, say that, okay, can I, like, or maybe I will remind you again, or something like that. Becomes much better, rather than just saying that I'm just writing it because I'm not residing in India, so I'm emailing you, and please excuse me regarding that and all that. And it would be great if you issue me a letter. Okay, so it's important. And this again, I have reproduced this with permission, and that's why I'm showing you the names. I've earlier not shown because of my own reasons, but this is please remember, once you ask for certain things, you have had this kind of, good support from whoever, your professor, your institution. Please remain thankful and grateful to them. That's also important, because if you don't do that, then again, it can actually hamper your further relationship. So just a courteous email, dropping that, doesn't, like, harm. In fact, they'll be very happy. You see that, I got selected, you are getting back. And then, I'm extremely grateful to you for having been my referee throughout the application. See, it gives you so much of happiness. and the person definitely gets, you know, a very nice thing. This is so nice. And see, after a couple of months, when the person gets in, writes an email, you feel so happy. So that's also part of the thing. Please also remember that when they ask you for reference as a referee, they ask you so many things, including intellectual ability, and please remember the written communication skill, oral communication skill. So we have to judge candidates, and these are all online now. Olden days it was on the paper, but now it's online, and we have to mark 5 to 1 or 0 also, unable to comment. Okay, so many things, but so please remember that communication also plays a very important part, and that's the reason why students need to understand and know that they should have demonstrated these things, and they should have had the ability to actually hone their skills. So that brings me to non-verbal communication. Now, body language, the way I interact, my body posture, my facial expression, the eye contact I make, my posture. I'm just sloping like this, and then I'm just on the couch. That doesn't give you a kind of impression. And of course, it's a webinar, so may not be that appropriate. But then, if you are in person, even the way you meet person, your gestures, your hand gestures, your body posture, everything has an importance. Even that smile. So that's very important. And please remember touch, but with a word of caution, especially in our societies when it's the genders are different. You need to be a little sensitive to that. So please remember that just because I'm saying, it's not be that touch is important. So you need to be careful. And if you look at that, as I said, which would you prefer? Obviously, out of the three, the smiling face, not somebody who's frowning, not somebody who's just blank expression, but a face which is charming, smiling, that exudes confidence, that exudes pleasantness. So that's important for us, and that's all part of communication. Again, the way we stand, the one on your left is a closed posture, somebody standing with hands folded, whereas the one on the right is an open posture. So again, that gives an idea about the person and the mental makeup and things like that. So it's very important. Same way, if I'm pointing towards somebody, that's kind of sometimes very threatening, or sometimes it may not be taken very nicely, or it might be somebody gets taken aback. So what's important is, again, you can have a open hand instead of pointing. You can just, and even one more thing what I would like to say is, then you want to address an audience, even if it's a small audience, 6, 8, 10 people, try to have a glance through everybody and then look at and try to connect with people. That's very important, because please remember, verbal is 35% only, but non-verbal is a large chunk. It's 65%, which includes facial expressions, the tone of voice, which I just demonstrated some time back, movement, appearance, the eye contact, the gestures and the posture, and as I mentioned, including things like the way I conduct myself. So all these are important. Unfortunately, this video is not playing very well, but the link has been shared, and I would strongly recommend that you look at this and maybe some other videos which are available. But yes, that's important to understand that even sometimes not just the spoken word, but how do we carry ourselves, including our non-verbal communication, is important. At the same time, there might be occasions where silence is as important. Silence is golden. Somebody is trying to narrate their difficulties, their sorrows, their suffering, their pain. You need to just be silent, listen, give an expression which is like, yes, I understand. You have my solidarity. That's important, because that, even if you can't do much, but that conveys a lot of meaning, a lot of strength to that person, and that person connects with you. So that's important again. A few things before I wind up. So communication skills, in case you are trying to deliver something, you have to face somebody, you have to make a presentation, please remember, you need to assess what is at your hand, what is the situation, and then based on that, you build your message. You build your message targeting the audience. You need to understand what is the context where you're going to present, who's your audience, what exactly is your main message, and that should be powerful. And then, having done all that, you need to document, because documentation is very important. So also in your practice. And then, please remember, when you do all these things, but you need to deliver, and delivery also involves emphasize on certain things. Make your words clear, simple, and understandable. At the same time, emphasize on certain things and use a posture, a body language, and your grooming appearance, everything which goes with that. And that's very important. Now, I'll just compare this communication with making a nice recipe, whatever you like it. It can be any traditional recipe, it can be Western, it could be pizza or any other thing. Now, in that, when we start off, we make sure that everything is in proportion. Then only the dish tastes good. You can't have too much of anything and too less of any other thing. So please remember, similarly, we have certain things like clarity, brevity, impact, context, and value. Now, clarity. Your message should be very clear. It should be very clear. Make sure that your message is reaching the right audience and it's clear. At the same time, sometimes you're hard pressed for time. For example, I meet somebody or my boss and he's walking up. I have very little time and I want to probably gain his or her attention. So I need to just speak and I have to tailor make that for 30 seconds or 1 minute. And if I want, I can build on that so that I can say I can come back and discuss. But I need to get that attention. I need to make my message tailor made so that I can get that undivided attention and the person gets interested in what I am trying to say. So brevity there, that means you keep it short and sweet. At the same time, what impact it will make. So you need to remember that if I'm trying to deliver a health education talk, it has a particular impact, and how it will make an impact and what I'm, so I need to make sure that that is very clear and brought up. At the same time, in what context I'm talking and what value it brings in. So all that is very, very important. And then again, my message has to be accordingly. Sometimes you might have to have brevity more. Sometimes you might have to have value increased. Sometimes you might have to have the impact highlighted much more, or context built up and then deliver the message. So depending on the situation, you will have to tailor make your message. Of course, it comes with practice, but at least being aware is the first thing, and you start off. So it's important for you to deliver your message according to the situation. So what makes a good communicator? Clarity, adequacy, right timing. Now, if you're seeing something happening and you can't come back after a couple of hours or the next day and you say, oh, you did that, you need to use that opportunity, your timing. You need to do it then. Integrity. Now, that's very, very important. That means doing the right thing even when nobody else is watching you. And that's important, because if I am showing my integrity, automatically people will trust me, they will connect, and they will also listen to my message and digest it, apply it. So just to end with some quotes, the good clinician treats the disease, but the great clinician treats the patient. That was said by William Osler, which is very true. And please remember, if I have to deliver a very short message, I need much more time to prepare. So if I had more time, I would have written a shorter letter. Sir Winston Churchill, the erstwhile Prime Minister of UK or Great Britain, had said this. And again, if you have to be concise, you need to really work on that, because you need to bring in only the relevant elements. You need to keep all the other extra things, away, and focus on your message and also how to deliver it. Last tip, 7 C's of communication, effective communication. Please make sure your message is complete. Even if it's brevity, doesn't mean that you speak something half. As I said, you have to have everything. It should be concise. It should be considerate to the person you're speaking to, should not straight away hurt. But at the same time, it should be clear, which I've been emphasizing. It should be concrete. It should be correct, factually correct if you're using some things. And you need to be courteous, because that is something which you show respect with. So That's something which I want you to understand. Please remember, every good conversation starts with good listening. And that's the reason I started my conversation with you with listening and talk about listening. Good communication is not just spoken or written words, it's much more. I'm sure that you know and you understand that now. I acknowledge the Paymer family as well as Mary Beth Skellen and also the medical education unit of KMC Mangalore, and of course Mero Eye and the Optometry Today group for giving me this opportunity. So thank you so much. Dhanyavad from India again. That's thank you. And you may reach out. If you have any questions, concerns, I would be happy to take a few of them. And Kapil, over to you.
Thank you so much, sir, for such a wonderful. Yes, sir. Thank you so much, sir, for such a wonderful presentation, Doctor. Yes.
Thank you so much, Kapil. Thank you. If there is anything that I need to answer, address, I would be happy to for a few minutes.
Thank you, Doctor. So we are heading towards the next session, that is the discussion session. So if anybody have the question, please unmute yourself, or you can directly speak with the sir, or either you can chat on the chat box. I'll be read out for the question.
Right. So if there is, I believe there is nothing.
I guess, yes, I guess everyone is clear about the presentation. So let's wait for a few minutes if anybody want to. Anybody want to?
I'm available for.
Okay. Yes, we have no more question anymore. So,
all right.
Considering the time limits here, I announce the closure of the discussion session. Yes, sir.
Thank you so much.
Thank you, sir.
Thank you.
Before ending the today, yes, sir.
Yeah. So may I log out or?
So just a minute, sir. Before ending the today's session, I'd like to express my sincere gratitude towards the presenter, Dr. Animesh, sir, and all the attendees. And also, I'd like to appreciate all the helping hands for the iTalks program. Herewith, I'm ending the today's session, requesting all you please review, please drop your review and feedback. Once again, thank you so much. Thank you so much, Doctor. And we'd like to appreciate all your effort to our platform, and we want to see you again and again in our platform, sir.
Thank you. Thank you so much.
Thank you so much. Have a good day, sir.
You too. Take care. Please stay safe.